Tracheostomy ventilation. This video is designed to support you in using both the Nippy 4 and Nippy 4 Plus ventilators. Bag contents. In the bag, you will find the device, power cord and circuit, along with any extras you may have been provided with by your treating team. Setup. Set the device up on a clean, hard surface ready for use. If the device is being used with a humidifier, ensure it is positioned lower to the ground than the patient interface, mask or tracheostomy. This will prevent water collecting in the tube or interface. Navigation of the device. Display screen, power button, audio pause button, carry handle, power supply, side panels and release buttons, air outlet. The power cable comes in two parts, a plug socket and a power supply. These two pieces must be connected together. Plug the power cable into the rear of the device. The connections are color-coded, so the grey attachment fits into the grey socket, marked 12 to 24 volts, and connect to mains power. The LED supply will show you which power source the device is currently running on, from either AC power, DC power, the click-in battery, or the internal battery. Power on. To power the device on, press and hold the power button on the top of the device for a couple of seconds. It will then take a few moments for the device to initialize and go into standby mode. Preuse test. During the startup sequence, your clinician may have programmed your device to allow you to perform an optional pre-use test. The pre-use test calculates the resistance and compliance of the circuit being used and increases the accuracy of delivered therapy and alarms. The results of the pre-use test are stored on the ventilator memory, so it does not need to be performed prior to each therapy session, but would need performing were a different circuit to be used or additional component added, for example, a humidifier. Be aware that on the Nippy 4 and Nippy 4 Plus, a patient may have more than one ventilation profile set, for use at different times such as day and night, or well and unwell. Individual pre-use tests can be performed against each patient profile, where different circuits are being used. As such, you would need to ensure the correct circuit is in use for the correct profile. If applicable, these details should be outlined in the patient's care plan. Profiles are accessed and changed using the Mode button at the bottom left on the front of the device and will be discussed later in this video. You will also need to remove any leakage port, also known as an exhalation port, from the circuit temporarily for the purpose of completing the pre-use test. The circuit configuration must be totally sealed if it is to pass the pre-use test. Follow the instructions on the ventilator screen for full guidance throughout. Initially, air will pass through the circuit to assess the circuit resistance. Keep the end of the circuit unobstructed for this step. It will then ask you to block the end of the circuit, cover completely and maintain a seal whilst air is pushed through the circuit again. It will then tell you whether the circuit pre-use test has passed or failed. The test can be completed again if necessary and takes approximately 1 minute. The pre-use test may fail due to excessive resistance, such as the tube being compressed or water in the circuit, or excessive leak, such as the end not being fully sealed or components not being firmly attached or damaged. Should a pre-use test fail, inspect all components in the circuit thoroughly to identify potential issues and repeat the test. Starting therapy. When the ventilator is ready to use, the screen will read, "Ventilator is in standby, patient is not being ventilated." Your ventilator will be locked into its home mode, so you will be unable to change any clinical settings. If you have multiple profiles set, please check via the mode box in bottom left-hand corner of the screen that the profile is correct prior to starting therapy, and that the appropriate circuit and interface is connected. To start therapy, press and hold the power button at the top of the device until the bar on the screen loads fully. If you do not hold this button for long enough, therapy will not start. Once therapy has started, then you will see the pressure, flow and volume bars moving up and down on the main screen. Circuit leak. There will always be some leak in a ventilator breathing circuit, either expected from the leakage port or from an uncuffed or deflated cuff of a tracheostomy. The amount of normal leak will be individual to you. This may also increase when asleep due to increased leak around your stoma site as your airway relaxes. Your treating team will be able to guide you as to what is acceptable. If leak increases to an unacceptable level, then you may start to experience an activation of certain clinical alarms such as disconnection or high flow. If this occurs and no obvious source of additional leak can be found, then you should speak to your treating team about your ventilator's alarm thresholds. Stopping therapy. To stop therapy, press and hold the power button at the top of the device until the progress bar on the screen loads fully. You will then be asked to confirm that you wish to stop therapy as a safety feature. Either select Yes by pressing the button next to the word Yes, or use the audio pause button on the top of the device to stop therapy. If you do not wish to stop therapy, select No, Cancel using the button next to this command. If an alarm is triggered whilst you are in the process of stopping therapy, you will need to silence the alarm and restart the process of stopping therapy. Therefore, ensure you have stopped therapy before disconnecting the patient from the ventilator. Ventilator alarms. There are two types of alarms on the Nippy 4 and 4+. There are medium priority alarms which will be identified by a yellow message on screen and a flashing yellow LED light in the top right corner with an audible alarm, and high priority alarms, which is signalled by a red message on screen and a red LED light in the top right corner, and a more continuous audible alarm. Your ventilator's alarm parameters are set by your treating team, so they will be individual to you. To silence any alarm, press the audio pause button at the top of the device. This will silence the audible component whilst allowing you to review the alarm on screen. The most common alarms are circuit disconnection, high flow, low flow, rebreathing, and low battery. If you wish to silence all alarms for 2 minutes, you hold the audio pause button on top of the device for 2 seconds and confirm by pressing Set on the main screen. In order to unsilence the audible alarms, press the audio pause button on top of the device one more time. You can tell if the alarms are muted if the orange LED light next to the alarm bell icon at the top right of the device is lit up. A circuit disconnection alarm or high flow alarm may indicate a high circuit leak. Check the circuit is intact and connected to the device. A low flow or low volume alarm would suggest the airflow is limited. Check for any blockages or kinks in the circuit, or potentially secretions within the tracheostomy tube itself, and ensure any antibacterial filters in the circuit are clean. A rebreathing alarm may also indicate reduced leakage from the circuit, in which case you should inspect the leakage port. A low-minute ventilation or low tidal volume alarm may indicate an unintentional decannulation. Alarms may also be triggered when nebulizers are entrained into the breathing circuit, although this will be temporary, and alarms can be silenced during this time if this is advised by your treating team. Air filters. The device will draw in air from the environment, so there are some air inlet filters to protect the mechanics from dust and debris. To check the cleanliness of these filters, lift the carry handle and press the button on the right-hand side of the device to release the side panel. There are two filters, a grey one for larger particles and a white one for smaller dust particles and allergens. Check the filters weekly. The grey filter can be washed with warm soapy water, left to air dry and replaced into the device, whereas the white filter should be changed at least monthly. When replacing the filters, the white filter should be closer to the ventilator and the grey filter should be outermost. There may be spare filters in the device bag, or you may need to request these from your treating team. There is also a cooling fan filter which needs to be checked every week and cleaned if required in warm soapy water. Failure to regularly check and clean the air inlet filters and the air cooling fan filter can lead to the ventilator overheating and having an impact on patient therapy, so it is important to do this each week as a preventative measure. Using the click-in battery. Additional click-in battery packs can be added to the device and can provide up to an additional 6.5 hours battery backup. These batteries will charge when the device is running on mains power. The status of the battery can be viewed on the screen with a percentage given for how much battery life is left for both the click-in and internal batteries when connected to live power, and hours, minutes available when operating on battery. The ventilator will use the click-in battery as its first option before switching to internal. The delivered battery life will be dependent on the ventilator's settings and level of leak being generated, so it is recommended to complete a trial run at home on battery power to determine how long the battery will last on an individual basis. The device will alarm to indicate when the battery is at 50% and also when it is reaching a critically low level. To insert the click-in battery, when looking at the device from the rear, lift the carry handle and on the right-hand side press the innermost button closest to the handle, button labelled number 1, to release the side panel. The battery fits below the air bypass chamber. Make sure both are clicked into place fully before replacing the side panel. If they are not clicked in fully, an alarm message will appear on the screen. External battery for the Nippy 4 An additional external battery pack can be added to the device. The Preuse X-Pack battery can have a single cell which supplies 9 hours of ventilator backup time, or a dual cell option which provides 18 hours of backup. It's important to know if it's a single or dual cell X-Pack battery you are using, so you can know what backup time to expect. Please note that the X-Pack battery must be charged off the mains power, and it will not charge off the back of the ventilator. It will take about 4 hours to fully charge it from empty. Switching profiles. To navigate between the various profiles that have been set up, select the button next to the profile label and use the plus and minus and set buttons to select the desired patient profile. When selecting the chosen profile, the settings will be surrounded by red boxes and you must press Confirm to complete the change. If switching between modes that require different circuits, the device will prompt this on the screen. Make sure the correct circuit is being used with the chosen profile, as should be outlined in the patient's care plan, if applicable. Entraining oxygen. Oxygen may be entrained either into the rear of the device or via a connector within the circuit. Your treating team will advise on where this is best placed for you. Only start entraining oxygen after starting the device, and stop entraining oxygen before stopping therapy. This will avoid any alarms being triggered. The connector at the rear of the device should only be in place if oxygen is being entrained to prevent dust being actively pulled into the device when uncovered. To remove the connector, press the trigger latch on the left-hand side of the oxygen inlet, and it will release from the back of the ventilator. Please note, oxygen entrained via the circuit will impact measured flows and tidal volumes and associated alarms. As such, whichever method you use for each patient, either via the circuit or back of the ventilator, you should stick to that method post-discharge and not change back and forth. It's best to entrain via the device if feasible though, to maintain accuracy of delivered therapy. Remote Start-Stop button. Plug the remote into the black socket on the rear of the device to use. To start therapy, press and hold the power button on the hand control for 3 seconds. The device will beep when you first press the button and beep twice when the therapy is starting. To stop therapy, press and hold for 3 seconds and then press again to confirm stop. Unlike using the power button on the main device, it will not show the progress bar on the screen when starting and stopping therapy. Invasive breathing circuits from Preuse. Circuits for use with patients who have a tracheostomy come in different configurations depending on an individual's needs. Typically, you will have a dry circuit that will be used during the daytime and then switch onto a heated, humidified or wet circuit when at home or overnight. Pediatric patients tend to use circuits with a 50mm diameter, and adult patients will usually have circuits with a 22mm diameter. Dry circuits tend to include a heat and moisture exchange filter, or HME, included in the circuit to act as a source of humidity and prevent a patient's airway from becoming too dry. It is typically recommended that the HMEs are changed every 24 hours, or in line with each manufacturer's guidance. Very importantly, invasive ventilation circuits should always include a source of intentional leak to enable the patient to clear their exhaled carbon dioxide from the circuit. Preuse UK will be standardising the type we use in our invasive wet and dry circuits by only using these purple leakage ports. If for any reason the breathing circuit's leak port is blocked or accidentally removed, carbon dioxide would begin to build up in the circuit and the patient's lungs, which can be dangerous if left undetected for too long. In this scenario, the low flow and/or the rebreathing alarm should be activated on the Nippy 4+ in order to detect the reduction in leak flow. It's important to note that breathing circuit configurations will all have slightly different resistance, compliance, and flow characteristics. This is why it is important that the Preuse test is carried out when a circuit or circuit component is changed, in order to optimize the delivery of patient's therapy. Whenever a circuit is changed, the alarms on the ventilator should be actively tested by creating a disconnection circuit blockage, and also by testing the rebreathing alarm by temporarily occluding the leak port for 3 consecutive breaths. Active circuits, Nippy 4+ only. When using an active valve circuit, you would need to attach the Nippy 4+ pilot line connector to the rear of the ventilator. Unlike leakage circuits, these have an active exhalation valve, which is controlled by an additional pilot line, which runs down the outside of the breathing circuit. Remote monitoring modem, eyink. You may have an eyink 4G modem accessory, which is required to stream the ventilator data to the hospital treating team. The eyink need to be connected to the mains power and also to the Nippy 4 via a micro USB cable. When attached to the mains, the eyink will attempt to connect to the cellular network. When it powers up, it will display a steady red light for about 15 seconds, and then start scanning for a 4G signal by showing a flashing alternate red and green light. If successful at connecting to the network, the LED will show a steady bright green light for about 15 seconds, before dimming. If the eyink will not connect to the 4G network, it will not transmit your therapy data, and you should contact your treating team.